I initially realized when that I had fibroid was I was scared. I got scared. It's because I was diagnosed to have quite a number of fibroid.
Yeah.
So I'm having a doubt in terms of the procedure that I was referenced to, for which I would undergo. And I had to do some research, a lot of research to enable myself be at peace, because I don't know the procedure and how it would go, and so also I do referencing from YouTube.
Go on.
I was referred to Dr. Usha, for which, due to several referencing of doctor who had already seen my case, I never got that confidence to do it. So when I went with Dr. Usha and I went to see her during the first consultation, she made so much clarity towards the procedure and how or what's going on inside of me, what's happening, the transition would be, what worst thing could have happened if I don't. So therefore, I was diagnosed to have, in fact, by that time, a 9 centimeter fibroid, which is quite as large as a big grapefruit. For which I remember, if I remember it right, she said that this is the amount or the size of your fibroid. So it was made clear to me that I really had to go through the laparoscopic myomectomy, and so Dr. Usha gave me that confidence to undertake the surgery. On the day of surgery, being a Christian, I prayed a lot because I was told that I'm going to be having the surgery early in the morning. So it reaches to my attention. I really have to prepare for it, which means I have to sleep early. I have to drink enough vitamins for which she had given me prior to, a lot of liquid, and I'll just have to prepare myself healthy for the procedure. So when I arrived here, we were accommodated by the hospital. Dr. Usha made it sure that the procedure and the process will go smoothly from the time that I arrived. So I promptly arrived on time. And then she also came, in fact, earlier, from which I remember because I saw her from the back, I saw her back towards the operation room. And then, on that day, I'm certain that I'm in a good hands because of her confidence. That confidence radiated to me, and that's the reason why I felt no shiver. I felt I wasn't frightened, in fact, on the procedure itself. I know that I'm going to undergo a surgery, but the laparoscopic myomectomy is not a full incision. So it was just a tiny holes that she explained confidently, because it was made to be on layman's terms, so I can understand, not to be overly technical of medical terminology. So the moment that I saw her in the operating room, that gave me a full relief that I am definitely in good hand. And after that procedure, I would definitely be feeling at least somehow anew, although there would be some recovery. But on that day, I knew that the entire team on the operation, led by Dr. Usha, would be a success. As soon as I woke up at the recovery room, I know that the surgery already were made. It's done. But I thought it was just like minutes ago, because if I remember again, I was just told that I was tested of the allergies, and then the doctor, anesthesiologist, said that I will be placed into an anesthesia. And just before he finished 8, I already passed out. So when I woke up, I thought it's just like 10 minutes of surgery. And to my amazement, I'm already under recovery. And in fact, I was awakened by one of the nurse. I may be sleeping well enough, so therefore they had to bring me to my ward. So when I got to my room, it's very comfortable, and how I felt is like half of my body does not feel because of the anesthesia. So it's still there. It may not be comfortable because the numbness is present. However, that at least somehow helped, because you would know that if you feel it, it might really be painful because it's still fresh. Although I'm already expecting that because no wound is really as easy to be recovering from, especially if it's somehow somewhat similar to a major surgery. And understanding what the process or how the process would go, so I acknowledge that there would be pain on the very first day. It is what made it difficult is because, or challenging, is because the passing of gas. So you know that the very first day, to make sure that everything went well, you need to cooperate with everyone else to ensure that the procedure in fact was a full success. Therefore, I had to cooperate with the passing of gas. So food was managed. It's just a soft diet, and the nurses are on schedule, deliberately on schedule. In fact, you get to be monitored and taken care of by the hospital. Again, under the leading of Dr. Usha, she gets to visit me. In fact. From time to time, but then again, the series of doctors who are in there to take care and to guide me for however if I get to feel something that are likely uncomfortable. Challenging also that after you pass gas, you need to urinate, and urinating requires you to carry with you, for which I have taken photo of myself, carry on a catheter. So that made it quite uncomfortable because the anesthesia sheds off a little while right after, which is sufficient from the time that I was operated. And after that, I even I crave for food. So I know that everything now is going normal because I got hungry. Fortunately, I'm cooperating. I was told that I cannot eat pretty much solid food, except for what was administered to be catered for patients who had undergone laparoscopic myomectomy. I liked the procedure, and I even looked at how my wound was dressed on the very first day, the way how they get to check. Courageously enough, I saw how it looked like while taking a video of myself doing however they get to check it. What's astonishing was that on the second day that I had to undergo, where the anesthesia already had gone, they had what helped, by the way, is that they've got a electronic digital thing that had to exercise pressures on my legs because I'm not walking just as yet. So at least I was explained that it is meant to circulate blood flow on your lower part of the body. So on the second day was so that they had to pull out the bag of, or the pipe
drain.
The drain. They had to drain. They pull out the pipe drain.
Yeah.
So that
which is put in to collect any blood that might be there inside.
That might be there. So it was really, I was told to count, but then again I felt brave. I had to weather that. I had to muster my courage to know exactly how it felt. When it really felt
sharp shooting pain.
Sharp shooting, I don't know, whirlwind of pain that you can feel it inside. That you can feel that the tube is really pulled inside you without anesthesia. And this also is when you still have that hole.
Yeah.
I was even doubting if my blood would drip at the moment that that pipe or that drain would be pulled out. But no, I was explained that the wound is really, really thin.
Yeah.
It's just that I thought it's like 10 inches, but it's not 10 inches, but it's really
10 millimeter.
10 millimeter. So I told myself, wow, you're really brave to master your courage, because not everyone, I was told, really can endure that much pain sometimes. Yeah, I don't know how to explain it, but I'm thankful that I went through that, because I am grateful to be experiencing all those moments, so that I'll be able to share it, and that others also may learn from my experience. When I went home after 4 days, on my fourth day, I was fetched and I was assisted by my friends, two of my lovely friends, so was able to support me and somehow they assisted me towards errands or things that I needed to do, administering, let's say, something that to pick up, something to have myself be cooking. But that's little or the pain isn't that much. In fact, it's just that I am doubtful to be moving as much as I used to move before, because still I have just gone under surgery. So my friends always tells me that it's not yet, like, although you haven't gone through that big surgery, it's just for you tiny holes, still that isn't normal because the surgery is
Inside surgery is still major.
So they always remind me, because I bend, I'm kind of clumsy, moving as much as, and I was like, "Okay, you forgot, maybe the wound would open." So my thought is that because outside you hardly feel it, but inside I was always remembered by these two friends of mine. They say, like, be careful of how you move. You are lifting already bottles of water, you should not. And I was told of those restrictions too. It's just that maybe because for me, as if nothing happened, and because the wonders of Dr. Usha made a point she, but the fact that it's really true, it's really tiny holes on you, so you don't feel like it's, it's something.
Because it's laparoscopy, the recovery is much better.
It's much better. It's much better, and I like also the thought that during those recovery stages, I only were assisted by some of my friends only during dressing, because I cannot lean or I cannot stoop to check and to put the plasters on. Other than that, you'd feel normal. That first day you're gonna have to be careful. Okay, fine, I am not, but then but then my friends always said, we're gonna have to be careful. Second day, I feel like everything is normal. I can take care. I mean, I take a bath on myself. Even on the first day, I took a bath. I took a shower myself. While I was in the hospital, even with those tubes, I took a shower myself. So it's nothing to be scared of. Nothing. The cobwebs of doubts and skeptics about things like you don't know now. At least somehow I can say that you'd be surprised. It's really amazing with the wonders of those who really are experts. So I would say that no one else's would touch internally in my body, especially for that sensitive areas, except for Dr. Usha. Administering anything else from day 2 would be easier as you breeze, even to day 5. I mean, I do the dressing myself from day 4, so it's really a quick recovery.